Colorectal cancer is one of the most commonly occurring cancers in the country. In fact, it's estimated it'll cause more than 52,000 deaths this year. Joining me to talk about this is Dr. Doug Benson. He is a colorectal surgeon. And Dr. Benson, I understand that both men and women are at risk for this cancer. So what are some of the signs and symptoms they can watch out for?
So some of the basic signs are some can be non-specific. It can be vague abdominal pain. I would say the most common thing we worry about is any kind of change in bowel habits or rectal bleeding. A lot of times people will just can throw it off and say it's hemorrhoids, it's some other benign condition, which a lot of times it is, but occasionally those can be more harbingers of more serious issues going on with the colon or the rectum. But a lot of times it can be vague and non-specific. The other issue is a lot of times for colorectal cancer is it won't produce a lot of abdominal or anal rectal or colorectal GI symptoms or anything else until the disease is becoming more advanced, and that's where screening comes in, and early screening, early detection, where outcomes can be really favorable.
Sure. I mean, we hear about that often with almost any disease, and primarily certainly with cancers, that you want to have early screening and early testing. Is there an age when a person should start getting these sort of tests?
Yeah, there is. So the American Cancer Society just a couple years ago just changed the recommendations. Everyone is still, a lot of people still think age 50 is a time when if you're an average risk patient, you're running through your normal routine physicals. Because of an increase in incidence in patients in their 30s and 40s having colorectal cancer, the American Cancer Society has reduced the screening age recommendation for all people at age 45 instead of age 50. If you have a family history, that puts you at higher risk. And there are even some hereditary syndromes that put you at much higher risk. If you have a family history of colorectal polyps or cancer, you should be screened at age 40, and then earlier if you have any more higher risk factors. But age 45 is the new recommendation for both men and women.
You know, I'm sure all of our viewers have seen those commercials for those at-home tests. What would you say is important to know about those versus getting a colonoscopy?
I think the at-home tests serve a purpose. There are some people who just, for various reasons, do not either want it, or there's other reasons to not pursue a colonoscopy, which is by far the gold standard, the best way to look at these and evaluate the colon rectum. But these at-home tests, there's what are called fit kits, there's Cologuard, there's a lot of different ones out there. They do serve a purpose. They can pick up lesions. Or when they test positive, there is a chance that there's a serious lesion. It's not as sensitive and specific as colonoscopy. It does miss some serious lesions. It will give you what are called false positives as well, where you get a full workup and find out that it ended up not being anything. But it is better than not doing anything. It is for people who are averse or do not get a colonoscopy. It will pick up and detect lesions, and again, potentially in an early stage when outcomes can be very favorable. But the kind of cons are it can miss some things. The other cons is it can financially impact how reimbursement is for the colonoscopy and be more out of pocket when those tests become positive. So, I usually recommend colonoscopy, but I do also see a purpose for these at-home kits. It's a way to get screening to more people, because the numbers show that still only about 60% of adults after the age of 50, but now 45, will ever get a colonoscopy. So there's a huge segment of the population who don't get screened that normal way. It's a way to reach out to that segment of the population to get them screened.
Sure. Well, that kind of is a perfect segue into our next question here, which is how the pandemic, my goodness, it's affected all of our lives in so many different ways. But we know a lot of folks haven't been going to their own doctor to get the checkups that they need. How has the pandemic perhaps impacted even colorectal cancer testings, and why is now the best time for folks to get back in?
Well, it's always a good time to get back in. Now that restrictions are being lifted, I think people are going to be more willing to go in. I think one of the issues that we had during the pandemic was because there was a lot of concern for other health issues, and you had this huge issue with the virus going on, that people kind of looked at preventative and screening tests as not really necessary in a time of a pandemic. And that's, I think, been not the best approach from a public health standpoint, because we have seen a couple, just anecdotally in talking with other surgeons, we have seen what we feel is an upstaging of cancers, where people who would have gotten screened in 2020, 2021 now are finally getting screened, and they're coming in with a little bit a later stage of cancer than they would have if they would have gotten screened. So that's another, so people are adverse to coming in and still nervous. I always tell people the hospital is one of the safest places to be. It's always been one of the safest places to be. Right. Our infection control parameters at facilities is much better than anywhere else that you've been through during this whole pandemic. It's a safe place to be. I try to reassure that. But if, for people who are still hesitant, these at-home test kits, again, are a way to reach people who would be more adverse to coming in and get a colonoscopy.
Sure.
But still, colonoscopy by far is the gold standard. It's the best way to screen.
Okay, so whether you do a colonoscopy or an at-home test, let's say you get those positive results that you have colorectal cancer, what do people need to know about the treatment options?
So the treatment options, well, the first thing with any type of thing that might be cancer, you want to diagnose it. An at-home test kit that says it's positive doesn't necessarily mean that. Like I said, there are false positives. Right. So the first thing to do is to diagnose it. Then you would get set up with either a GI physician or colorectal surgeon, someone who does a lot of colonoscopies, to get that formal colonoscopy, because that can diagnose the tumor if they find it. So so you find the tumor that caused that positive test, you diagnose it. Then you stage it, and the treatment options are usually surgical, but it depends. There's a whole lot of different factors with radiation treatment, with oncology and good chemotherapy regimens, and then surgery. And typically it does require surgical removal of the segment that's involved.
Sure. Well, it sounds like we need to get folks in to see you or to see their own physicians, just to make sure we're getting those screenings back on track. So Dr. Benson, thank you so much for your time and for sharing all this important information with our viewers. We really do appreciate it.
Thanks for having me.
Of course. We'll be right back.